If you're dealing with depression, you've probably heard that exercise can help. But how does it actually compare to therapy? The answer may surprise you. A massive new analysis just compared decades of research on exercise and depression. Today we're breaking down what 73 clinical trials actually found. I'm going to show you the specific type, intensity, and duration of exercise that the evidence suggests works best for mental health. Here's something that caught my attention. The research suggests you don't need to push yourself to exhaustion. In fact, lighter exercise may work better. And there's a specific number of exercise sessions that appeared to hit the sweet spot for reducing depression symptoms. It's not what most people would guess. We're also going to look at which combination of activities showed the strongest effects, and why your typical cardio routine might be missing a key ingredient. But first, let me be clear. This isn't about replacing professional mental health care. It's about understanding another tool that research suggests may help. Depression affects over 280 million people worldwide. That's more than the entire population of Indonesia, making it one of the leading causes of disability globally. For decades, the main treatment options have been medication and psychotherapy. Both remain valuable, and they've helped millions of people improve their quality of life. But there's growing interest in what exercise can offer. Not as a replacement, but as something that might work alongside, or even as an alternative for some people. Think about who this matters for. People who can't access traditional treatment, those who prefer non-pharmaceutical approaches, or anyone wanting to complement their existing care. The question researchers have been asking is simple. When we look at all the evidence together, how does exercise actually stack up against established treatments? That brings us to the Cochrane collaboration. If you're not familiar, Cochrane reviews are considered the gold standard for evaluating medical evidence. What makes them special is the rigorous methodology. Researchers systematically gather every relevant study, assess quality, and synthesize findings using strict protocols. In January 2026, researchers from the University of Lancashire published an updated Cochrane review on exercise for depression. The scope was impressive. They analyzed 73 randomized controlled trials involving nearly 5,000 adults who had been diagnosed with depression. This is the most comprehensive analysis to date. Understanding the scale matters here. Previous reviews looked at smaller pools of evidence. This one captures decades of accumulated research from around the world. Here's the headline finding. Regular physical activity may ease symptoms of depression about as effectively as psychological therapy, based on moderate certainty evidence. That conclusion comes from 10 trials that directly compared exercise to psychological therapy. The researchers rated the evidence as moderate certainty, which is meaningful. In research terms, moderate certainty means the findings are fairly reliable, though future studies could still shift our understanding. It's strong but not definitive evidence. The review also found that exercise led to moderate reductions in depressive symptoms compared with no treatment at all. That baseline comparison is important. Let me put it another way. Doing some form of regular physical activity appears substantially better than doing nothing, even if you're already feeling low. Now here's where it gets interesting. When researchers compared exercise directly with antidepressant medication, the benefits looked similar. But there's an important caveat. The certainty of that comparison was lower, meaning we need to be more cautious about drawing conclusions there. This doesn't mean you should stop taking prescribed medication. What it suggests is that exercise might be a meaningful addition to treatment for some people. The most surprising finding for many people will be about intensity. The data suggests that light to moderate activity may be more helpful than vigorous workouts. That goes against the popular idea that you need to push hard to see mental health benefits. The evidence points towards something gentler being potentially more effective. Why might this be? Researchers have several theories. Intense exercise can trigger stress responses, while moderate movement tends to be more sustainable and enjoyable. There's also the practical angle. If exercise feels punishing, you're less likely to stick with it. Consistency matters more than intensity for long-term benefits. Speaking of consistency, the review found that greater improvements in depressive symptoms were linked to completing between 13 and 36 exercise sessions. That's roughly 3 months of regular activity if you're exercising once or twice a week. It's not an overnight solution, but it's also not an endless commitment. Think of it as a realistic time horizon. You wouldn't expect therapy to work after one session either. Both approaches need time to create meaningful change. The type of exercise also appeared to matter. Programs combining different types of activity and resistance training appeared more effective than aerobic exercise alone. This is an important detail. Most people think of exercise for mental health as going for a run or doing cardio. The evidence suggests variety may be more beneficial. Resistance training specifically has been gaining attention in mental health research. Building strength appears to have effects beyond just the physical. Some researchers theorize this relates to feelings of competence and self-efficacy. When you get stronger, there's a psychological benefit that pure cardio may not provide. The biological mechanisms are complex. Exercise affects multiple pathways relevant to depression, including inflammation, neuroplasticity, and neurotransmitter function. When you move your body, you're not just burning calories. You're changing your brain chemistry in ways that researchers are still working to fully understand. There's also something to be said about the social and behavioral aspects. Exercise often gets people out of the house, into routine, and sometimes into community. Some researchers question whether the benefits come specifically from exercise or from any structured activity that breaks isolation. It's a fair point worth considering. The 2024 network meta-analysis published in the British Medical Journal helped establish exercise as an effective treatment for depression before this Cochrane update. That earlier analysis looked at different exercise types and found walking, jogging, yoga, and strength training all showed meaningful effects on depression symptoms. The January 2026 Cochrane review built on that foundation. It confirmed the findings with even more rigorous methodology and a larger evidence base. What we're seeing is scientific consensus building. Multiple independent analyses using different methods are reaching similar conclusions about exercise and depression. Now, I need to address some important limitations. When people are severely depressed, even getting out of bed can feel impossible, let alone starting an exercise routine. Some researchers caution that initiating and maintaining exercise can be extremely difficult for those with severe symptoms. It's a real practical barrier. This is why exercise shouldn't be seen as a standalone treatment for severe cases. Professional mental health care remains essential, and exercise works best as part of a comprehensive approach. The evidence for comparing exercise to medication had lower certainty. Experts argue that antidepressants remain important for moderate to severe depression and shouldn't be dismissed. So what does this mean for you? If you're dealing with depression symptoms, the research suggests adding light to moderate exercise may help. You don't need to push yourself to exhaustion. Consider a combination of activities, including some resistance training, not just cardio. The evidence points toward variety being potentially more beneficial than single-mode exercise. Consistency appears to matter more than intensity. The sweet spot in the research was 13 to 36 sessions over several weeks, which is achievable for most people. Here's a practical starting point. Aim for 2 or 3 sessions per week of light to moderate activity. Mix some walking with simple bodyweight exercises. Start small if you're struggling. Even a 10-minute walk counts and can build momentum. The goal is to establish a habit you can actually maintain. Resistance training doesn't require a gym. Bodyweight exercises like squats, push-ups against a wall, or resistance bands at home can provide similar benefits. Consider activities you might actually enjoy. Gardening, swimming, dancing, or hiking all count. The best exercise for mental health is the one you'll actually do. If you have diagnosed depression, continue working with mental health professionals. Exercise works best as an addition to proper care, not a replacement for it. Talk to your healthcare provider about incorporating exercise into your treatment plan. They can help you figure out what's safe and appropriate for your situation. There's one more thing worth mentioning. The benefits of exercise extend beyond depression symptoms. Physical activity is linked to better sleep, reduced anxiety, and improved overall well-being. When you're dealing with depression, those secondary benefits matter. Better sleep alone can significantly impact mood and energy levels over time. The biological mechanisms connecting exercise and mental health involve multiple pathways. Physical activity reduces inflammation, promotes growth of new brain cells, and affects neurotransmitter balance. These aren't instant changes. Like the Cochrane review showed, benefits build up over multiple sessions. The brain needs time to adapt and respond to regular physical activity. This is why the 13 to 36 session range makes sense. You're essentially training your brain alongside your body, and that takes consistent practice. Be patient with yourself. If you miss a session, that's completely normal. The research is about overall patterns, not perfection. Just get back to it when you can. Consider tracking your mood alongside your activity. Many people find it helpful to notice patterns between movement and how they feel in the days that follow. Studies suggest the mental health benefits can start appearing within the first few weeks, but the more substantial changes seem to build over the longer time frame. This parallels what we see with therapy and medication. Mental health interventions generally work gradually, rather than producing overnight transformations. The Cochrane review specifically noted that the quality of evidence varies across different comparisons. The exercise versus therapy finding had moderate certainty. Moderate certainty in Cochrane terms means we can be fairly confident in the effect estimate, though further research could have an important impact on our understanding. Science is always evolving. What we know about exercise and depression will continue to be refined as more high-quality studies are completed in the coming years. But the current evidence is strong enough to act on. The question isn't whether exercise helps with depression. That seems clear. It's about how to apply it effectively. Let me give you a simple framework. Week 1. Just walk for 10 to 15 minutes 3 times. No pressure, no expectations. Just establish the habit of moving. Week 2 through 4. Gradually increase to 20 or 30 minutes and add 1 session of light resistance training. Bodyweight exercises are perfect for this. Months 2 and 3. Maintain consistency with 3 sessions per week. Mix activities based on what you enjoy. This gets you into that optimal 13+ session range. Remember, the research showed light to moderate intensity. That means you should be able to hold a conversation while exercising. If you're gasping for breath, you're pushing too hard. Listen to your body. Some days you'll feel more capable than others. The goal is sustainable activity over weeks and months, not heroic individual sessions. There's an interesting nuance in the research. Group exercise and supervised programs often showed slightly stronger effects than exercising alone. Social connection may play a role. If you can, consider joining a class or finding an exercise buddy. The accountability and social aspect may enhance the mental health benefits you experience. But don't let that stop you if group exercise isn't available or appealing. Solo activity still showed meaningful benefits in the research. Do what works for your circumstances. Here's a practical tip. Schedule your exercise sessions like appointments. Put them in your calendar. Treat them as non-negotiable commitments to your mental health. Prepare your workout clothes the night before. Remove friction wherever possible. The easier you make it to start, the more likely you are to follow through. Don't wait until you feel motivated. With depression, motivation is often the last thing to arrive. Action frequently comes first, and motivation follows. This is one of the challenges researchers acknowledge. Depression makes it hard to start the very activity that might help. It's a real catch-22 for many people. If you're really struggling, start even smaller. 5 minutes of stretching counts. A walk to your mailbox counts. Any movement breaks the inertia. Mental health professionals are increasingly incorporating exercise recommendations into treatment plans. It's becoming part of comprehensive care, not an alternative to it. The 2026 Cochrane Review represents the most current and comprehensive look at this evidence. It builds on years of previous research and includes the latest trials. What makes this research compelling is the consistency. Multiple studies, different methodologies, various populations, and they keep pointing in the same direction. Exercise isn't a magic solution. Depression is complex, and different people respond to different approaches, but the evidence clearly suggests movement belongs in the conversation. Let me summarize what the research tells us. Regular physical activity may ease depression symptoms about as effectively as psychological therapy, based on moderate certainty evidence. Light to moderate intensity appears more beneficial than intense exercise. Variety matters. Combine different activities, including some resistance training, and aim for 13 to 36 sessions over time. This isn't about replacing professional mental health care. It's about understanding that movement can be a powerful part of a comprehensive approach to feeling better. Please remember, always consult your doctor before making changes to your health routine, especially if you're dealing with diagnosed depression. This is information, not medical advice. If you found this helpful, subscribe so you don't miss our next episode. And if someone in your life is dealing with depression, consider sharing this with them. Your health is in your hands. Small steps lead to meaningful change. Thanks for listening to Better Health Faster. Take care of yourself, and we'll see you next time.